Good afternoon, everyone. We're just going to give it another minute or so before we get started today. All right. Well, in the interest of time, we will get going. So good afternoon, everyone, and welcome to the second of a three-part Integrated Food Safety Centers of Excellence webinar series, focusing on food safety in correctional facilities. My name is Ingrid Hewitson, and I'm with the Colorado Integrated Food Safety Center of Excellence, or Food Safety COE for short. We're one of 5 food safety COEs from across the country with the mission of providing peer assistance, resources, and training to support state and local health departments in building their capacity to track and investigate enteric diseases. The topic of today's webinar is managing high-risk foods in correctional settings. And we have 3 subject matter experts from Nebraska, Michigan, and CDC joining us to share their outbreak experiences. But before we get started, I'd like to briefly go over a few housekeeping items. So this is a Zoom meeting and it's set up in webinar mode. So you'll only be able to see and hear the presenters. And if you have any questions for our presenters, please add them in the Q&A feature or in the chat box, and we'll answer as many as we can, either in the chat or at the end of the webinar during our Q&A session. Please use the chat box now to share where you're joining us from this afternoon. We always like to see who all is on. And if you're experiencing any technical difficulties, please send a message to the all panelists option for assistance. We do have live transcription available, which can be turned on or off by clicking the Show Captions button on the toolbar at the bottom of your Zoom window. And lastly, if you're not able to stay on for the entire webinar or would like to rewatch it, a recording will be available in a few days on the same webpage you used to register. So now that all the technical details are out of the way, we would like to get to the presentations. And I'm pleased to introduce our first presenter, Andrea Bethke. Andrea is a senior environmental health specialist at Lincoln-Lancaster County Health Department in Lincoln, Nebraska. She serves as a food safety consultant for the Infuse Food Safety Consultation Program and is the environmental health EPI lead for the disease prevention program. She assists with outbreak response in retail food facilities and childcares. So, Andrea, I will pass it over to you.
Hey, thank you. I'm going to unmute myself and let's get going here. Okay, can everybody see my slides okay?
Looks good.
Looks good. Great. Thank you. So again, thanks for having me. I am really excited to talk about this and share what we learned about the outbreak that we went through. So again, my name is Andrea Bethke, and I work at Lincoln-Lancaster County Health Department, and in Lincoln, Nebraska, and we're the capital of Nebraska. And I work here at the local. We're also a local city-county entity, and we serve around 326,000 individuals in our county. And again, I've worked at the department for around 10 years. I started as an environmental health specialist, working as a food inspector in our food safety section. And then now I work as a food safety consultant in our Infuse consultation program. Again, I help serve as the EPI lead for our disease prevention program, which is for our food safety and our childcare, which childcare is starting to get a little busy because there's a lot of noro going on right now. And today I'm going to talk about an outbreak that we experienced at our county correctional facility involving mechanically separated chicken. So a bit of background. On January 14th, 2022, LLCHD received a call of 2 cases who were in the hospital that had tested positive for salmonella. The 2 individuals were inmates at the local county correctional facility. So our outbreak response team, we immediately convened, and we sat in together and called the head of the correctional facility. And at that time, correctional staff were reporting what was said to be approximately 100 inmates that were experiencing mainly diarrhea and stomach cramps. We did have some individuals indicating that they had vomiting as well, and that was lasting over multiple days. And also then at this point, we were already starting to hear from the correctional staff that the inmates were reporting to them, telling them that they were saying that they thought that it was a chili that was served on January 8th. Inmates were saying that it had an off, bad taste. Some were even comparing it to Parmesan. And also then at that time, there weren't any kitchen staff reporting any illness. So our outbreak response was initiated. Environmental health staff went to the facility to conduct an environmental assessment, which included interviews of inmates, staff, and guards. We also were preparing and getting ready to collect any food samples that were of items of concern. And then our communicable disease and also our EH staff were coordinating with the medical facility staff to provide stool sample kits to collect samples from inmates. So during the investigation, our team worked really closely with the corrections staff to maintain good communication. So we identified the officer that was in charge of overseeing the kitchen, and we made sure to communicate with them and let them know that we were going to be coming out to do this environmental assessment. We were already aware ahead of time, since we conduct inspections of that facility, that its food service was contracted out to a third-party company. This company specialized in providing food service to correctional facilities. The staff that they hired rarely engaged in the food preparation itself. Rather, they oversaw the preparation and serving of food by the inmates that worked in the kitchen. So before we arrived, the guards prepared the catering facility and the inmates that we were going to be coming to conduct some interviews. And the guards even really helped out too. They had identified, just through questioning of the catering staff, that there might be some leftover meals from around the date of exposure. So when we first arrived, there was already that getting gathered up so that we could, or identified so that we could come and collect these. And we took those right away to the lab for testing. So during our initial investigation, our EH staff, we conducted open interviews with all the kitchen workers and inmates on staff at that time when we were there to identify if anyone was still ill with gastrointestinal symptoms. We also asked what they would have consumed around the time of the suspected exposure and when they would have worked and what kind of jobs they would have done. We did identify that some of the kitchen workers had been sick, and then some inmates were letting us know that they were still experiencing diarrhea and stomach cramps. So anyone that indicated that they had been ill was excluded. So we were communicating with our communicable disease back out from the field to get guidance on to exclusion. And so we were working to exclude those individuals until they could be cleared by testing. And then in these interviews, we were consistently hearing from inmates that they were sick after that meal on January 8th. So onset time was, around the 9th and the 11th. And then we were also hearing again and again that they thought that it was this chili that was served on the 8th. We interviewed around 20 inmates, and this didn't cover all the individuals that had worked, as there was different shifts from when they reported to work. So we did work with the guards. We gave them some interview forms, and they conducted these interviews with the remaining staff that we weren't able to talk to while we were there. We also asked questions to help rule out foods because there was something we weren't thinking about, but there were some foods that might get prepared by the inmates themselves, by foods that's taken from the commissary, or food that might be smuggled in. So we were asking questions to make sure to rule that out as well. So, out of our interviews and testing of inmates, we defined a case as anyone with diarrhea, stomach cramps, or vomiting. We identified 15 cases. 5 were confirmed and 10 were probable, but we think that there were likely many more. We isolated Salmonella enteritidis as being highly related to the outbreak strain. And you here see some stats from what we identified from testing and interviews. But we also, again, we were finding out through our interviews that a product called MSC, or mechanically separated chicken, was used to prepare the chili. And I hope I don't slip up here, but during the whole time, every time, I just kept calling it turkey. So hopefully I don't slip up today, but it's chicken. What is MSC? It's produced in chicken processing facilities under high pressure that forces the meat off the carcass. And it makes this really yummy looking paste that you see here that can be used in products like hot dogs and chicken patties or nuggets. But at this facility, they were mainly using it to prepare like the big bulk, like soups, the stews, the chilies, the spaghetti, taco meat, things like that, in bulk. But companies like to use it because it's economically beneficial, as it's cheaper, but it also has nutritional value. But it's also more likely to be contaminated through processing, as we will hear, and then as we will hear like later on, when I'm talking, that how it's provided to facilities, that it can also pose more of a risk if food safety steps aren't followed. So at the facility, they did have some of this product left in their walk-in cooler. We weren't sure if it was from the same lot number that was used to prepare the chili, but it was from the same company, and it was delivered at the same time when we were going back and tracing back through the invoices. So we did collect a sample for testing of that product. We also contacted and reached out to FSIS, and we worked with them for guidance on testing this product. So what did we learn from our environmental assessment? So during our investigation, we identified several food safety risks in the process of the preparation of the chili and that MSC product that contributed to the outbreak. We conducted open-ended interviews of both the manager and staff that were directly involved with the preparation. And so I was sitting and asking and talking to the manager about the process, and they walked through with me that they receive it in these large 50-pound frozen boxes. So in that other picture you saw, it was in this really big box. So that's how they receive it, and they receive it frozen. And then they would place it, they would have it in the freezer, and then they would pull it as needed to thaw, and they would place it in the fridge for for a few days. But he said often, and he recollected that often it was frozen when they were cooking it. And so that was an issue. And the product was then placed in a large, big block that might be still partially frozen into a kettle to cook. And I remember sitting across from him and asking, like, well, how long would you say do you think it takes for you to cook that product? And he said an hour. And I remember my eyebrows going whoop, like, oh. And they weren't really monitoring that cooking time either. So they were trying to cook this big partially frozen block in a kettle, and they weren't always necessarily ensuring that it was getting cooked to 165. So again, the staff said that they may sometimes were taking temperatures, but it wasn't routine, and it was not being documented. But we did identify that the company had logs that they were expecting them to take, but they just weren't working to maintain and complete those. And finally, there was no policy for managing ill food workers. The inmates that were returning to work symptomatic, there wasn't any communication process with the inmates and guards to make sure that they were staying out from work for the appropriate amount of time, and there weren't any illness logs being kept for ill staff. There was a lot of turnover at the facility. So the manager was like brand spanking new. He hadn't been there very long. And then also, he had never worked in an institutional kitchen before. He actually worked at a bowling alley right before he took this position. And so he was more used to like cooking like, frozen pizzas. It sounded like he really didn't receive a lot of guidance and training when he first came on how to handle production in a large scale kitchen like this. We also experienced some challenges. We were still, and if you see the time, we were still in the middle of dealing with COVID-19. Many of us were involved in other areas of the COVID-19 response. There was an outbreak actually that occurred at the facility while we were conducting the investigation. It was closed. There was a point it was just closed to any additional environmental assessments or interviews. Thankfully, we had already done most of our assessments and interviews by this time, so it really didn't impact too much that. But then interviews themselves were a challenge. Inmates have limited access to communication like computers or phones. So typically when we conduct investigations, our EPI team creates a REDCap surveys that we can send out to the party. But because they didn't have access to computers or phones, I mentioned before, we had to utilize guards. And again, with COVID restrictions, we weren't able to really come in. So we had the guards help us conduct the interviews of the staff that worked in the kitchen we weren't able to talk to. Medical staff were also a big help with interviewing anyone that was ill, but also they were really overwhelmed. And I don't want to make it sound like they weren't able to provide medical care to the inmates. They were providing adequate medical care, but they just weren't able to really keep up with the numbers of how many were reporting vomiting and diarrhea. And so we weren't really able to get a true count of how many were having those symptoms. We also identified through interviews with the manager that the facility that they also catered to two other correctional sites, and so we had to chase down that information and talk to whoever was in charge there and make sure that there wasn't anybody sick at those facilities. Which thankfully we ended up that there wasn't, so didn't really get any bigger. So it was again good question communication that helped us work through that. And then finally, the catering company was initially cooperative, but and you guys probably maybe have experienced this, but as it went on, they became more reluctant to provide assistance and information. I talked about that product that was left, so we actually had put a hold on some of that product, in case we needed any other information or testing. So later, FSIS had requested that we get some additional information on these boxes, we went back and they were gone. And the manager said that, well, we threw it away because it was we thought it might start stinking. So we had to remind him like what a hold meant, and we then had to go to the trash compactor and dig that out. And thankfully, the maintenance and the guards helped us do that. But that was a bit of a challenge. But thankfully, they had some trash grabbers there that they could use. After these issues were identified, we worked with management and the corporation to discuss implementing, changing some practices. So I switched hats from being the illness investigator to a consultant, and I met on site with a manager to talk through some things, but I also felt like there would be more impact if we contacted the upper management of the company. It was a bit of a challenge, but we did finally get a hold of someone that was in charge of assuring food safety. And we did talk about developing a policy for ideal thawing time to ensure that the product was completely thawed before cooking. And the manager did on site make these changes and extended how many days they were thawing that product before cooking. We also discussed a different cooking method to ensure product was thoroughly being cooked. So instead of using the big kettle to cook that product, we talked about maybe using a tilt skillet and getting that fully cooked and then adding it to the ingredients. It would make it much easier to break that product up and cook it thoroughly, and then also to temp it. I can imagine how hard it would be to take a good temperature, accurate temperature of that product inside a big, huge kettle like it was being prepared in. And so finally, then we talked about training for managers and staff on processes to ensure that staff are monitoring and recording their temperatures and following safe policies and procedures. And then we reviewed about having accountability for managers to ensure that from upper management to ensure that the managers on site were following these procedures. And we also encouraged, like, think big, like, this happened here, make sure to apply this at the, because they had other accounts like in other states, other facilities, like, hey, think big, apply this like to the other facilities that you have. So in conclusion, it was clear from our investigation that a product like MSC can pose a great risk if food safety practices are not followed. You can see that there have been other types of outbreaks linked to this product, and correctional facilities can be a source of some of the largest outbreaks for individuals, and can be 6 times more likely to become, someone that's incarcerated could be 6 times more likely to become ill from someone that is not incarcerated. And so there's lessons that can be learned from some of these issues we observed from the preparation process of this MSC product to make it safer. And you'll be hearing about some of these recommendations later in the presentation. Otherwise, thank you.
Thanks, Andrea. That was really interesting. If you have any questions on the presentation, please go ahead and add those to the Q&A box, and we'll get to them at the end of the webinar. Or you're welcome to answer them in the Q&A box as well, Andrea. For those of you who just jumped on, if you could throw in the chat where you are coming from, we would appreciate that. We got it functioning, so you can add it there now. So our next speaker today is Julie Payne, and Julie is a graduate from the University of Michigan School of Public Health, where she received her Master of Public Health. She's worked in healthcare for 30 years and has experience in both public and private sector healthcare. She worked at the federal level as an intern in the Public Health Service in Washington, D.C., and also worked in the private sector for electronic data systems in Detroit, developing one of the first data systems for HMO accreditation. She's been a communicable disease epidemiologist at Kent County Health Department in Grand Rapids, Michigan since 2002, and has published articles in the CDC's MMWR and Journal of Emergency Medicine. She's currently an epidemiology practicum supervisor for several local colleges in Michigan, and recently worked on Kent County's application to be awarded a CSTE host fellowship site. So I will pass it over to you, Julie.
Okay, thank you. All right, can you see that?
Yes, we can. Thank you.
You can hear me. Okay, our investigation takes place in Kent County, and the largest city in Kent County is Grand Rapids, Michigan. And this is a picture of Grand Rapids and the Grand River, which flows out to Lake Michigan. And the population of Kent County is almost 700,000 people. And the city of Grand Rapids is almost 200,000 people. And I've provided some data here on the racial makeup of Kent County, which has really changed since I moved to town in the early 90s. It was about 90% white when I moved to town. And then our racial makeup has really changed in our Black and Hispanic population. As you can see, I think it was only 2% Hispanic when I moved to town. Now it's 11% Hispanic. And I just need to move something here. On April 16th, 2012, at 8:30 a.m., a call came into the Communicable Disease Unit in Grand Rapids, Michigan, from an employee of the Kent County Correctional Facility. A suspected foodborne outbreak was taking place, and approximately 30 to 50 inmates were ill with vomiting and diarrhea after eating lunch. On April 15th, 2012, no staff were ill. This estimate would later increase to 250 out of 1,140 jail inmates ill. The lunch was served April 15th, 2012, was suspected to be the cause due to inmates reportedly becoming ill within an hour of eating their meal. Some inmates developed symptoms later all the way into the morning of the 16th. Additionally, inmates complained the meal had a foul taste and odor. April 16th, a foodborne investigation team was formed of nurses, public health nurses, epidemiologists, and environmental health staff. Communicable disease epidemiology staff developed a questionnaire using the jail menu for the 72 hours prior to the illnesses. Face-to-face interviews were requested by facility staff due to literacy problems and other problems with written form. Interviews were conducted on April 17th and 18th. A total of 185 inmates, including ill and well individuals, were interviewed. The Kent County Correctional Facility is a central booking facility for inmates committed to the custody of the sheriff. The correctional facility houses inmates who have committed crimes with sentences less than or equal to a year, who have committed misdemeanor or felony offenses. There's a variety of housing that includes single, double, and 8-man occupancy cells to house 1,500 inmates of all security classifications. And these are some pictures of the outside of the Kent County Correctional Facility. And I just wanted to highlight there are 2 towers to the correctional facility, and one is a women's side and one is a men's side. This is a picture of the inside of the jail cell. This is an 8-man occupancy cell, or sometimes they're referred to as pods. And then this is a 2-person. And I wanted to highlight how little privacy there is when having to use the toilet, use the restroom. And these are some other interior pictures of the jail. And this is what it was like when I went to the women's side of the correctional facility. We were stationed at tables down below here to conduct interviews. And then instead of there being all these guards here, there were a lot of inmates milling about. And some inmates were behind this glass area. And then there were guards up in this tower up above, and there were just a couple of guards down below. So there was some concern about our safety. So safety was a bit of a concern for us in particular. The suspect meal was served Sunday, April 15th, 2012, between 10:30 a.m. and 12:30 p.m. A chicken taco meat mixture, rice with cheese sauce, refried beans, and a flour tortilla was served. A garden salad with optional salad dressing, yellow cake, powdered fruit drink were also offered. Correctional facilities are not licensed food service operations of the state of Michigan and are exempt from inspections. They have policies in place indicating they must comply with the FDA food code and the Michigan food law. At this time, the correctional facilities food service operations were contracted to a private food company responsible for preparing meals. Overall cleanliness was pretty good on the first inspection on April 16th. Food was checked and was found to be at acceptable temperatures. Stored leftovers had names and dates. The company kept sample trays of previous meals, and a tray containing the suspected meal was obtained and was immediately brought to the health department and stored in the lab cooler. And this was an example of one of the food trays we took into custody, not the actual sample tray that we used for testing, but just another food tray we took into custody. On the second inspection on April 17th, the main goal of the investigation was to obtain more food trays for testing. 5 pans of beef stroganoff were found at temperatures ranging from 77 degrees to 170 degrees 3 hours after cooking. No temperature logs were available when temperatures dipped below 135 degrees and there was no date marking. And trays of food had condensate trapped beneath the cellophane that covered the trays, indicating that improper cooling methods were being used. On April 18th at 1:30 p.m., on the third visit, a company employee refused to provide the Kent County Health Sanitary and more sample trays. The company kitchen manager contacted the regional manager, who called the corporate office to determine whether she could give the health department the tray. By 3 p.m., no response was received from corporate, so the supervising sanitarian consulted the health officer and medical director. Both felt the sanitarian should obtain the trays. The health officer contacted Kent County Legal Counsel. Kent County Legal Counsel got involved and stated that the Kent County Health Department needed to have the trays in their custody. On April 19th, the additional trays were taken into custody. On April 30th, more information was received on other relevant food items that were eaten during the suspect meal. Pinto beans were used for refried beans for chili con carne. The beans were soaked in cold water overnight in the walk-in cooler. The rice that was prepared with 1 part rice, 2 parts water, and cooked to 165 degrees. The cheese sauce served with rice came from a powder that was mixed with water, and it was heated to 145 degrees. And there was turkey sausage that was used in the meal from Friday's biscuit and gravy dish that was mixed in with the chicken meat. The first interviews that were conducted was with the kitchen manager. And she said the meat was prepared from mechanically separated chicken, and it was prepared on Friday, April 13th, and it was cooked in a steam kettle, much like Andrea's investigation as well, I noticed. And then it was moved to the freezer, but then it was eventually moved to the walk-in cooler. And then it went to after it was stored in the walk-in cooler on Sunday, it was moved back to the steam kettle to be reheated. And then it was moved to the steam table, and then it was dispensed onto trays. And no temperatures were taken, but she didn't say that at that particular interview. And she received a call after the trays were dispersed that the meat was bad almost immediately after being served. And she checked the temperature in the oven, where the pizza oven where these trays were being kept warm, and the temperature was 90 degrees. And another person was interviewed, and it was, oops, let me go back. An inmate trustee who worked in a pod, and he said that the meat was made Thursday, April 12th, not Friday the 13th, and stored in 4-inch deep, sorry, I can't see some of this stuff on the screen. Was stored in 6-inch deep hotel pans, and the meat was used for Friday's biscuit gravy dish, and the meat was added to the griddle, and no temperatures were taken. So these were deeper pans. The meat was then put into the steamer for 2.5 hours, and one checked it had swelled and overflowed. Eventually, it was moved to this pizza oven. There was a third story by the Kent County Sheriff Department cook. He cooked 9 loaves or bricks of meat on the griddle on Friday, April 13th. He said no temperature checks were performed. And on Sunday, this individual then cooked 4 more boxes of meat and added the older meat from Friday onto the griddle. He also added a small amount of Thursday's biscuit gravy meat, approximately half full bucket. The meat was placed in the hotel pans and placed in the steamer. One checked, it was found to have puffed up out of the pans. And another kitchen trustee stated that the meat was used for the 4:15 lunch came from Thursday's biscuit gravy meat that was cooked days before. The biscuit gravy meat was combined with meat made on 4/15/2012. This worker ate the taco meat, rice, beans, and cheese on tortillas at 8:30 a.m. he ate 5 tacos. By 10 o'clock, he started having stomach cramps. In all, there were 5 different stories that were obtained. 2 people said the meat was prepared Thursday, 2 people said the meat was prepared Friday, and 1 said the meat was prepared Saturday. So this is what happens when you don't keep temperature logs. And I just wanted to review that we know from our foodborne training, many of us do anyway, that there's a temperature danger zone, that hot foods must be maintained at 135 degrees or above. And I believe that's what it was at this time. I think now the standards might have changed to 140 or above, so that pathogenic organisms do not multiply. And cold holding foods must be maintained at 41 degrees or below to inhibit the growth of pathogens. The improper cooling of foods is one of the most common causes of foodborne illness. And one key aspect of this is that food temperatures should not exceed 70 degrees within a maximum of 6 hours. For our analysis, the case was defined as any participant that ate the suspect meal and experienced vomiting or diarrhea. Our data showed that 108 of 185 individuals were identified through application of the case definition. Onset of symptoms ranged from April 15th at 11 a.m. to April 18th at 8 p.m. Incubation ranged from 1 hour to 81 hours. Onset time of illness was a median of 7 hours, mean 9 hours. Attack rate was 58.4%. Predominantly people had abdominal cramps. That was the leading symptom, followed by diarrhea, nausea, vomiting, fever, and 14 people had bloody diarrhea. Predominantly, with the demographics, 77% were male, 22% female. Largest group by age group was the 20 to 49-year-old group, followed by the 10 to 19-year-old group, and then 50 to 70-year-old age group. We had 3 missing ages. And then our epidemic curve showed that most of the illnesses occurred within the first 24 hours. And within literally just an hour or 2 to 3 hours after eating the food. And the statistical analysis showed that using a EpiInfo6 database, that there was a statistically significant association with the Tex-Mex taco meat, and the odds ratio was 55.8. The cheese sauce was 8.9, and then the rice and the beans followed those odds ratios in descending order. And then we also had a statistically significant association with the breakfast sausage. Stool samples were collected for 6 inmates who were willing to provide stool samples, and the samples were submitted to the Michigan Bureau of Labs, both for bacterial analysis and enterotoxin identification through polymerase chain reaction. Food specimens were analyzed using PCR for enterotoxin source identification and incubated for plate count. And just a word about Clostridium perfringens. It's found in intestines of humans and domestic and feral animals, and it's found in soil and sediment. And small numbers of the organisms are often present after cooking and multiply to food poisoning levels during cooling and storage of prepared foods. Spores germinate and multiply during slow cooling and storage at temperatures of 68 to 140 degrees Fahrenheit. And meat products, gravy are the foods most frequently associated with Clostridium perfringens outbreaks. 6 stool specimens were analyzed for Bacillus cereus and Clostridium perfringens. All specimens were negative for Bacillus and positive for Clostridium perfringens enterotoxin. The rice with cheese was found to have a colony count of 15 million colony forming units per gram. The beans had a colony count of 370,000 colony forming units per gram. The Tex-Mex taco had a colony count of less than 10 colony forming units per gram. So there were 2 possibilities for what we saw with our statistical information and what was seen with the sampled food. And we thought there were two possibilities for the differences seen between what was sampled and the statistical data. And that the possibility was that through sampling error, laboratory error, and uneven distribution of organisms, the chicken taco meat mixture sampled that was analyzed for colony count was uniquely underrepresented with viable Clostridium perfringens, or the bacteria population with the chicken taco meat mixture had either reached death phase due to gross spoilage, diminishing nutrients in a changing pH environment, or had been diminished by the final reheating prior to service on April 15th without harming the integrity of the enterotoxin. While the data appeared to suggest conflicting causative food items, Kent County Health Department concluded that the chicken taco meat mixture was the most probable cause. The high odds ratio, history of temperature abuse, possible contamination by external ingredients, and testimony from inmates regarding the strong odor and frothy appearance seemed consistent with Clostridium perfringens in the taco meat mixture. And we published this article in the Journal of Environmental Health. We had many recommendations of, about how to handle the food in our report. But anyway, the article is listed here if anyone's interested. Thank you very much.
Thank you, Julie. That sounds like a huge outbreak. I can't even imagine how many people. So now I would like to hand it over to our last speaker, Naomi Drexler. But before I do that, I just want to mention that if folks have any questions, you can throw them in the Q&A section. It looks like we've got one for you, Andrea, if you want to take a stab at answering that. And hopefully we'll have some time for additional questions at the end. So yeah, Naomi. I forgot to introduce you. Naomi is an epidemiologist in the Division of Foodborne, Waterborne, and Environmental Diseases at the Centers for Disease Control and Prevention, where she leads projects, conducts analyses, and develops strategies focusing on disease prevention. She was the lead author of the Model Food Safety Practices for Correctional Facilities Guidance and is leading CDC's effort on correctional food safety. She's worked at CDC for more than 12 years. So now I will hand it over to you.
So I appreciate this opportunity to talk with you all about our model food safety practices for correctional settings. I think, you've heard quite a bit throughout the previous two sessions about, the problems that can happen in correctional facilities and leading to some of these outbreaks. But what I hope to be able to share with you in these last few minutes is some of the solutions, or what I hope will be some of the solutions for foodborne outbreaks in this setting. So the motivation for this particular document came from an analysis that Andrea mentioned, where we took the foodborne outbreaks that are reported from state and local health departments to CDC through the Foodborne Outbreak Disease Surveillance System. We compared outbreaks that were occurring in correctional settings to non-correctional settings from 1998 through 2021. This builds off of the Mariel Marlowe publication that Andrea mentioned. And we were able to identify that incarcerated individuals experience 6 times more outbreak-associated illnesses per population than the public. And further, the outbreaks that they were experiencing in correctional settings were on average 6 times greater. So kind of decisively identifying that there was a disproportionate burden of disease for this setting. We also had the opportunity to look at contributing factors that were identified in these outbreaks and found reoccurring issues like lack of time and temperature control, which speak to kind of the lack of basic food safety operational control. So these data indicated to us that increased food safety action was needed in this setting. So you may be thinking that there are already gold standard documents that address food safety, like the FDA Food Code, and you would be absolutely right. We found that there were a couple of different logistical items that create a unique environment in correctional settings that might necessitate having a separate document. And I've outlined a couple of those here. So it kind of comes down to where food is being prepared and who it's feeding were the main elements. So in correctional facilities, food is often prepared in those large batches, like from those kettles that both Andrea and Julia had mentioned. And it may be held for extended periods of time in order to accommodate multiple services, or food services. In many instances, food is also being harvested, served, and prepared by both incarcerated and detained individuals, as well as employed individuals. And keep in mind that some of the incarcerated food workers may not always receive the same level of training as employed food workers. We also think it's important to keep in mind who is receiving this food. So correctional kitchens may be serving some of be the sole source of nourishment for incarcerated and detained individuals, including those who are at higher risk for severe foodborne illness. So that's our older adults, people with weakened immune systems, and pregnant people. And because this food may be the only option for these vulnerable populations, we think that all food that is prepared from these settings should be able to be served to those vulnerable populations. So created at that level of standard. Lastly, we think it is important to keep in mind that any food operations materials that are used in correctional facilities do jointly need to address both food safety as well as security concerns. And without having that duality, we run the risk of being tone deaf. So we developed these model food safety practices as a evidence-based practice, gathering together evidence-based practices so that are specifically adapted for the correctional environment. These model practices are intended to be applicable for federal, state, local, tribal, and territorial facilities of all sizes. We do think it's important to note that this is not intended to serve as a regulatory framework, but more be a set of best practices and recommendations. These model practices are based on established documents like the FDA Food Code, as well as the Federal Bureau of Prisons Food Service Manual. But additionally, we took those lessons learned from the outbreaks that have been described by my colleagues, as well as other outbreaks in our correctional analysis to identify important preventative controls that could have been utilized. We know that there are a wide range of infrastructures and resources available in correctional settings, so we did provide two levels of application. A standard application, which generally aligns with the FDA Food Code, we think should be applicable for any level of facility. Everybody should be able to apply those levels. And then we also have an advanced level of practice, which provide additional levels of food safety. And we hope that facilities will strive to achieve those advanced practices when feasible. This document was written by subject matter experts at the CDC and the Federal Bureau of Prisons. We also obtained subject matter expertise input from the Food and Drug Administration and the the Food Service and Safety and Inspection Service. Now, while this document was written by federal partners, a critical piece of this drafting process was the input we obtained from external parties. So before we even started drafting this material, we conducted listening sessions and interviews with both public health and correctional staff to identify what were some of the barriers and problems that they were experiencing. And then once we got through the first round of drafting, we opened the product up for individual external review, which was a really critical part for obtaining transparency, accuracy, and buy-in. And we're really excited that these model practices were released and published in October of this year.
Hey, Naomi, I hate to stop you. It seems like some people are having there's some sort of glitch. Could you stop sharing and then reshare and see if that helps?
Yes.
Folks, thank you. Oh yeah, everyone's seeing this one. Oh, maybe Julie, if you stop presenting, or some people are still stuck on Julie's. So hopefully, okay, it sounds like that worked now. So thank you very much.
You're seeing just my screen?
I think so.
Okay, great.
In the chat, it looks like it's working.
Thank you. Sorry, I hope I didn't lose too many people. We'll make some slides available if you need them afterwards. But this document covers a lot of target areas, everything, because food safety is such a multifaceted issue. We cover everything from food worker health all the way up to records management, what food to serve, and steps to take to minimize food safety risks in the preparation and service of food. We didn't want to repeat everything that was listed in the FDA food code. Instead, we wanted to highlight kind of the things that were most critical in this setting and anything that might be different operationally in correctional environments. So those are the topics we aim to cover. I don't have time to cover everything within the model food safety practices, but I do want to highlight some details of the document that I think are kind of priority actions for food safety in correctional settings. So first item here is choose, and we believe that there are several choices that correctional facilities can make to improve food safety. Facilities should be choosing to use approved food sources. And they can also choose to use less contaminated products. So this might include pasteurized dairy products, pasteurized egg and juice products. And as an advanced practice, choosing not to use raw mechanically separated meat and poultry products. We'll talk a little bit more about that in the next slide. But we also suggest that facilities choose to conduct external inspections at least 2 times per year. We believe that these external inspections are really an opportunity to build collaboration within a food safety network and reinforce food safety practices, review and reinforce food safety practices with some external eyes. So this can be state partners, this can be accreditation specialists, or other correctional partners, just somebody outside of your facility. So as we heard from Andrea, mechanically separated chicken, and I'm going to call this mechanically separated meat and poultry products, or MSK, have been implicated in a number of correctional outbreaks. And as Andrea mentioned, we know that these products more frequently can be contaminated with Salmonella and Campylobacter than other chicken, turkey, or pork products. So we spend quite a lot of time within our model food safety practices explaining what this product is so people understand what it is and its potential risks. But we do understand that some facilities are still going to need to use this product as an economical protein source. So the advanced practice is to exclude raw mechanically separated meat and poultry products because they have this potential risk associated with them if not handled properly. But if you have to use it, we do provide some risk mitigation steps, including thawing, and this will echo a lot of what Andrea mentioned, but thawing the product fully before use, so not cooking from frozen. Measuring the temperature multiple times throughout the cooking process and ensuring that you're reaching a proper depth. And then taking additional steps to minimize cross-contamination, because not only is the product, potentially risky, but the packaging as well. And there are opportunities for easy cross-contamination if not managed properly. The next step is screen. And we think that health screening can be an important tool for correctional facilities to prevent the spread of germs through food. All food workers should self-screen for symptoms daily and report any symptoms without a fear of reprisal to a food safety manager. Whenever possible, we would suggest that facilities should waive any medical copays for incarcerated food workers when they are symptomatic in order to eliminate that barrier for seeking appropriate care and reporting. And then any of those individuals who are identified as sick should be excluded from food work or work in any of the food areas for the appropriate incubation periods and until symptoms have resolved. Training also plays a really critical role in food safety in correctional facilities. We suggest that all workers should be trained in hygiene, safety, and that includes food safety and record keeping before they begin any food work activity or details. This can be on-the-job training, but it really does have to precede any type of work. And a refresher training should be conducted at least annually. More advanced and formal training is expected for the more advanced roles. So employed food workers should minimally be completing a food handler certificate, and managers should be completing a certified food protection manager accredited program. Time and temperature control issues were the most common contributing factors that we identified from correctional outbreaks. So we wanted to be sure to reinforce these practices at multiple points within the model practices. We do this first with a cook and hold, that all food items should be cooked in their entirety to reach the minimum safe cooking temperature. We recommend a slightly higher temperature for ground meat and egg dishes than are in the FDA food code because of the presence of these potentially vulnerable populations. And the other side of the temperature control comes from the cooling of food appropriately. And this is something that Julie mentioned was important in her outbreaks. So we emphasize the use of a two-step cooling process. So bringing hot food down rapidly within the first 2 hours to 70 degrees, and then continuing the cooling process to 41 degrees over the next 4 hours. This process, this rapid cooling, reduces the likelihood of spore-forming bacteria like Clostridium perfringens to germinate during that time. We also highlight that a number of correctional outbreaks included the use of leftover food products. Again, something that Julie's group experienced. And since these products end up undergoing several trips through the temperature danger zone, we consider them to be a little riskier. So standard practice would be to only use leftover products that have been appropriately chilled one time. And then an advanced practice would be to eliminate the use of leftover foods altogether. And that takes a lot of planning and control over the situation. So we realize that that is not going to be feasible for everybody at once. The last priority action for correctional food safety that I wanted to mention is cleaning. And this is most importantly coming from the promotion enabling of proper hand washing for those who are working in food work, making sure that the facilities are fully staffed and there's always soap and hot water and towels available for staff. Additional practices could be making sure that you have a standard operating procedure that your staff are aware of for protocols to react to body fluids and fecal contamination, not only within the environment of where food is cooked or served, but also on trays and serving equipment. And lastly, to hold chemicals in secured areas that are separated from food. So I know that I did that fairly quickly, and these are just a few of the highlights. I really do encourage you all to read the full document and share it with any of your external partners. We've got a QR code here, and I'll put the link to the product in the chat. And then I would like to thank my co-authors from the CDC and the Federal Bureau of Prisons. And I think we are happy to take any questions.
Thank you. For going over the model food practices. We were really excited when you got it launched a month or so ago, and are happy to have that as a resource. I'd also like to thank all of our speakers for their great presentations, and we are a little short on time, but I think we might have time for one-ish if someone throws it in real fast. You can add it to either the chat or the Q&A box. I did want to just put a shout out that Kyle put a kind of more comment in the Q&A box about Legionella outbreaks can also show up in facility ice machines. And since FDA labels ice as a food product, please ensure that all ice machines out there are maintained with clean, with ice scoops stored outside of the bin, and manufacturer procedures are followed, including required filter changes and sanitation. I don't know if anyone has any additions to that.
I'll just say that we mentioned ice machines in the model food safety practices, kind of cleaning those surfaces as food contact surfaces and maintaining clean apparatuses. So I thank you for that comment, Kyle. You're absolutely right.
Well, seeing none, and as we are down to the last 2 minutes, I would just like to thank everyone again for taking the time today to share their knowledge and experiences investigating outbreaks in these settings. There is a very short feedback form that'll pop up when you exit this meeting, and we'd really appreciate it if you could fill it out. It's completely anonymous and should only take a minute to complete, and we really use these to help us improve these webinar series and identify topics for future ones. Our final webinar in this series will be held on December 18th, and the focus will be on addressing food safety challenges, other food safety challenges in correctional settings. You can register it at the link posted in the chat, which is also the same link that you use to sign up for this one. We also put the link to the Integrated Food Safety Centers of Excellence website in the chat in case you would like to learn more about what we do. We have at least one tabletop exercise around correctional settings that you can use in your agency to kind of practice what you would do or how you would handle a similar situation. We also put in the email addresses for all of today's presenters if you have any specific follow-up questions for them. And thank you for joining today's webinar. This recording will be posted on the website where you registered, and I hope you all can make the last one, which will be again on December 18th. Have a great rest of your day, and thank you for attending.